name is Stephanie Igemba.
My name is Bola Adilawa.
My name is Pia McCardo.
And my name is Mary Barwick.
And here we're here to discuss our poster and research findings on our research topic, which is how nurse-to-patient ratio affects the quality of care. I'm going to start off by giving you a little bit of background information. Nurses spend the most amount of time with these patients, and they, within the healthcare profession. We would also want to advocate quality of care, and factors that hinder us from doing that need to be addressed and identified. Studies have shown that when nurses' workload is high, the surveillance of the patients becomes impaired, and they risk the adverse effects that may come onto these patients. Our objectives that we want to identify within our research were to identify and to understand the nurse-to-patient ratios and how it affects quality of care. We also wanted to find we wanted to show, the effects of inadequate nursing staffing and how that is going to affect patient outcomes, as well as wanted to construct some strategies that could be implemented in future nursing practice. My colleague Pia is going to be discussing the methodology that we use to gain our research.
Okay, the databases that we use for our research is EBSCOhost, Google Scholar, Sentinel, and Lippincott Nursing Center. The keywords that we enter in to narrow down our research is nurse-to-patient ratios, quality of care, nurse workloads, and nurse staffing. We narrowed it down to four studies that are quantitative and qualitative studies, and they were used to review and evaluate the topic being addressed. And now my colleague Bola is going to talk about the recommendations for practice.
Here are the recommendations we came across while we were doing the studies. There was the research shows that there was a lower nurse workloads, and they're in line with California, because California was used as a standard ratio for two states, New Jersey and Pennsylvania. So that was one of the recommendations by one of the researchers. Another one was done in China. It was a study of a Chinese of 181 Chinese hospitals, and they came up with the fact that if the ratio was increased to between 0.5 and 0.6, the patient safety will be ensured, there will be quality nursing care, and there will be increase in patient satisfaction. Another research, a qualitative study this time, said they're finding that what they had suggested was that the relationship between nurse staffing and patient outcomes, qualitative studies should be incorporated in the research. So in other words, they're suggesting that they don't only use quantitative studies. And the last one was said, their conclusion was, their recommendation was that the below target nurse staffing and high patient turnover, they are independently associated with a risk of death among patients. And so they're suggesting that the hospitals and payers and those who are concerned with the quality of care, they should pay increased attention also to assessing the frequency with which actual staffing matches patients' needs. Thank you. And my colleague Mary is going to round it up with implementation.
Okay, so one of the things that we did find was that research does show that nurse-to-patient ratio has a huge outcome in the way patients feel that they have gotten their care while they're still at the hospital. And we wanted to focus on more of working at a hospital or a nursing home as opposed to trying to change policy statewide. We can start small, and if we show how it works, then you can move on to making sure that it, take it to your legislatures. So one of the things that we determined that you want to start on one unit or one floor. You don't want to go too big. You want that small pilot program that we can start off with. We're going to educate our nursing staff, our regular staff that works on the floors, the assistants, to make sure that everybody knows what the research is and everybody knows what's going on and how we're trying to get this implemented. We want to create realistic short, mid, and long-term goals. And we want those goals to be flexible. We want people to be able to bring input back to us. We don't want to say this is the way it's going to be. This is a learning process. We're educating everybody. So we want to make sure along the way that what somebody says is or is not working, we can sort of change that and make sure that it goes the way it's supposed to be going. Then after we get one floor or unit up and running, you can move on, and you're going to take a nurse from that floor and you're going to put her on another floor, and she's going to be the mentor for that floor, the person that the entire staff knows that they can go to while the change is going on. And we're going to make sure that overall, the improvement of quality of care in patients, that is the most important. That's what we're looking for here. We want to make sure that we're not missing those bed sores, that the patients are being turned like they're supposed to be. They're getting the quality of care that they need and deserve while they're in the hospital. So we just want to make sure everything goes the way it's supposed to go. We want to use that evidence-based practice. We want to make things better for everybody all along, because if you have happy nurses, you have happy doctors, you have happy staff, you're not going to have the burnout that you see now, and you're not going to have the stress that you see on the floors now.
Okay, so we want to thank you guys all for paying attention and giving us your patience to listen to what we have to say. We will be handing out a brochure that includes what we have here synthesized in a shorter format, as well as our contact information if you have to contact us for any questions, okay? Thank you so very much, and that's it. Thank you.
Thank you.
Thank you.